Okay. Well, good morning, everyone, and welcome to how CEOs and CFOs can generate interest-free working capital. My name is Donovan Pyle, and I am the CEO of Health Compass here in Orlando, Florida. Our talk is going to be about 40 minutes, and then we will open it up for your questions. All right, I'm going to show you how to generate over $1,000 per employee per year in interest-free working capital. And I'm going to show you how to do it with some new techniques that you've probably never seen before. And at the end of this presentation, I'm going to offer you two white papers that will summarize everything. So if you like to take notes, put the pen down and we will move forward. So this slide just says a bunch of stuff about me. Here's everything you need to know. Our thought leadership has been featured in Yahoo Finance, Go Banking Rates, the Orlando Business Journal, and many other publications. We are endorsed by the National Association of Health Underwriters, as well as the Validation Institute, because we generate over $1,000 per employee per year in interest-free working capital by improving benefits. I'm one of 300 benefit consultants who's holds the highest designation awarded by NAHU, and I'm one of 20 benefit consultants that is certified by the Validation Institute. So I essentially have a fake PhD in health insurance and risk management because a formal one doesn't exist. But our approach and the results that we're able to achieve are simply based on behavioral economics and math. It's very simple. So I'm not going to talk about best practices. I'm not going to talk about benefits technology. I'm not going to talk about wellness programs. I'm not going to talk about any of the things that we usually talk about because the reality is those things just don't work. Okay, so here are some of the results that we've been able to achieve. Technology company down 18%, construction company down 22%, healthcare company down 10%, advertising down 33%. So my message here is this: your industry does not matter. If you employ humans, all of these things are possible. So here's our agenda. We're going to quickly talk about the challenges facing employers. We're going to go over the tale of two different companies. We're going to show you how health insurance actually works. And we're going to give you a strategic methodology needed to generate interest-free working capital, share a couple success stories, and then answer your questions. Okay, so we all know what's going on in the world right now. Businesses are facing wage compression, rising operating expenses, and challenges with human capital, how to attract and retain talent. So I want to start off by telling the tale of two different companies who had very different approaches to how they procure and finance healthcare and the results that occur because of that. So several years ago, Warren Buffett famously pontificated that GM is a health and benefits company with an auto division attached. Now, why did he say that? Well, he said that because just like Starbucks spends more money on healthcare than they do on coffee beans, GM spends more money on healthcare than they do steel. Just pretty incredible. And only 11 years after being bailed out by the federal government, GM had mismanaged their health plan so badly that they tried pushing more costs onto their employees. And what happened? Well, those employees didn't like that. 50,000 employees went on strike in 2019 because they, quote, wanted more equitable compensation and benefits, end quote. The strike cost the company almost $2 billion and forced GM to rethink how they finance and procure healthcare for their organization. And good news is that over the past several years, GM has actively worked to solve their company's healthcare problem and satisfy the needs of their employees. So let's contrast that with the story of Rosen Hotels, who, if you're in Central Florida, Harris Rosen is famous. But a lot of people don't know about the story, and it's quite instructive. So in the late 70s, Harris Rosen owned two small hotels, and he took a very different approach. His business was growing, but he wasn't happy with the lack of control he had over his company's healthcare expenses. At the time, Rosen had bought a traditional health plan and was part of a public risk pool, right? And after a year when his employees' healthcare utilization went down, meaning employees didn't use as much of the plan, he was surprised to find that his insurance rates went up. And he actually called the carrier himself, and the carrier told him, well, it's because of the risk pool. Your utilization went down, but the rest of the risk pool's utilization went up. Therefore, your rates are going up. And that was the moment where Harris, took the bull by the horn and said, no more of this. We're not doing this anymore. And he exited the public risk pools and started procuring healthcare for his 700 employees by himself. In that first year, his company saved his total spend went down 38%. And the story spread to Trend Magazine, who dubbed the program Rosencare. And 40 years later, the name still sticks, and the company has saved an estimated $450 million. They have a turnover rate that is a fraction of what their competitors have. The company provides just a really superior product as far as their health plan goes to their employees. And the company is 100% debt-free, and they've grown to over 6,000 employees. And if you listen to, I would encourage anyone who hasn't listened to interviews of Harris Rosen to do so, because he talks about how the reason he's able to do all this great philanthropic work for our community here in Central Florida is that he stopped wasting money on health insurance. So there you have it. One company waited until they needed bailouts and their companies went on strike before addressing their healthcare problem. The other one actively confronted the problem and received unimaginable returns from doing so. So, my learning here is this. It's not a matter of if more organizations change the way they finance and procure healthcare. It's a matter of when and how much financial pain they're going to endure in the meantime. So, serious question here. How many of you here today you still use one of these? Well, probably not too many of you, and there are some pretty obvious reasons for that. Well, they're expensive, they're inconvenient, and they don't actually do what you need them to do. So, a lot of things have changed since the 1990s, but at their core, commercial health plans, for the most part, have largely stayed the same, and that's a major problem. So, let's take a look at how these plans that have been developed in the 1990s have performed. I'm going to show you some amazing data. Some of you may know this already, but since 2010, premiums have risen 55% and deductibles have risen 111% faster than wages. And this means that companies and their employees are essentially paying much, much more for a much weaker product. Okay. And according to RAND and AARP data, health insurance inflation is one of the leading causes of wage stagnation in the U.S., magnifying the income inequality and potentially political unrest that we see today. Employees often delay and avoid care because of the costs associated with traditional networks and plan designs. Since quality metrics are usually not available to employees in traditional plans, they inadvertently end up receiving care from hospitals, providers, and surgeons who, let's face it, some of them have pretty low quality scores and they sometimes harm their patients. So, this stat shocked me to the core when I first learned it, but prior to COVID-19, medical error was the third leading cause of death in the United States. Just incredible. So because of all these things, employees don't really like their health plans. They give their health plan about the same net promoter score as their cable company. Just awful, just terrible, terrible. Okay, so how have we tried to fix this? Before I give you a list of things to start doing, I don't know if your plate looks anything like mine, but it's full, right? And so I'm not looking for more things to do. I'm looking for things to stop doing. And so here are some things I want all of our organizations to stop doing. Let's stop passing premium increases onto employees. It effectively negates the raises that you give them every year. Let's stop doing that. Let's stop absorbing rising premiums and eroding profit margins. Let's stop increasing deductibles and copays on employees. Let's stop chasing discounts off of infinity. Doesn't do anything. And let's stop hoping that wellness programs work. So many companies have invested so much money and time into these programs. They just don't work. They open you up to a litany of compliance issues. Let's stop doing it. Okay, so all of the things that we've been doing for the past 20 years have really just resulted in this. They really just undermined the whole point of our benefits program, right? The point of our benefits program is to help us attract and retain talent. And we've inadvertently been undermining that for years. So, even before the great resignation that we're experiencing today, employee quit rates had risen dramatically from 2010 to 2018. And obviously, there are many reasons why employees quit their jobs. But it's interesting that quit rates have so closely mirrored premium and deductible increases since 2010. So maybe it's just, one of the last, you've got a boss that you don't really like, and then, geez, our health insurance premiums are going up again. I'm done, right? I'm out. So the fundamental question we need to ask ourselves is, what are the root causes of health insurance inflation? How does it affect our businesses and communities? And so it starts with misaligned vendor incentives. And, the reality is that for years, many companies have hired benefits brokers who, let's face it, their financial incentives are misaligned with yours. They make more money when your costs go up, okay? It's like hiring a CPA who takes money from the IRS to make sure you pay more in taxes than you should. That just doesn't make any sense. It's been happening for decades without employers knowing it, and it needs to stop. And the reality is, brokers that do that, they're going to recommend vendors whose financial interests are also misaligned with yours, the consumer. So we need to stop that because it results in this downward spiral, lower margins, lower growth, slower growth, higher turnover, more administrative work for HR teams, et cetera, et cetera. We need to stop that cycle. So here's the answer. Over the course of working on the carrier side of the business and the brokerage side of the business, we invented a methodology, a roadmap that consistently drives down costs, not by diluting benefits and shifting costs onto employees, but by actually putting employers in a position where traditional market forces like price and quality are available in healthcare. Okay, and I did this, essentially using my fake PhD, where it became really clear that leaders had no viable way to control healthcare costs because no one told them that the vendors that they were using had business models whose financial incentives were diametrically opposed to theirs. So if there's one sentence I want you to take away from this presentation, it's this. More than anything else, the financial incentives of your broker and the vendors they recommend will dictate how well or poorly your healthcare investment performs. That's it. All right. Now, when we talk about healthcare, we need to stop speaking in terms of percentages and benchmarks. When I speak with HR groups, I tell them, if you go to your CFO and say, hey, we got a 5% renewal increase, but the benchmark for our industry was 6%, everyone gets a high five and we move on. But if you go to your CFO and tell them, hey, our healthcare costs are going up $500,000 this year, they're going to say, fix it immediately, right? Okay, so we've got to get HR pros speaking the language of CFOs so that we've got quantifiable or measurable goals for our multi-year strategy. And so when we talk about our overall strategy, the first step for many companies is this, and it's in the bottom left-hand corner of that slide, is to stop paying for healthcare that employees never actually consume. Very simple. In Central Florida here, we still have a lot of companies that buy these prepaid, fully insured products. You got to get away from that. And once we've stopped paying for healthcare employees never consumed, the second step is to stop overpaying for the healthcare they do consume. Remember, 25% of everything we spend on healthcare today is considered a waste. So what that means that the average savings opportunity for the average company is this. It's $2,590 per employee per year. That is material. Okay, so here's the deal. If we're going to win the procurement and supply chain management game, we really just need to be in a position where prices and quality metrics are available in advance so that concierge teams, medical management teams can educate and guide employees and their families towards high quality, fair cost healthcare providers. And knowing where to find high quality care is the deal. Without it, nothing else really matters. Okay, so to do this, let's first shine a light on the black box that is our current health plan. And everyone's coming from this, using their own definitions, preconceived notions. So it's important that we kind of level set so that we're all speaking the same language. And for those of you that haven't crossed over this threshold yet, just a warning, once you see this, you can't unsee it. You will never go back and look at your health plan the same way again. Okay, so here, the false choice that we've been presented with for years is this, and it's really the fault of the health insurance industry, specifically benefits brokers. We've been told for years that if you want a better health plan for your employees, you have to spend more money. And that is just simply a false choice. And the reason is this, again, if you're on a fully insured or level funded product, you're probably paying for healthcare your employees never consumed. And then two, you're overpaying for the healthcare they do consume. Doesn't work. Let's move on. All right. So if your organization still buys those old school plans, it's impossible to identify price or quality, and you're not going to be able to optimize your spend. You got to move away from that. In this situation, carriers really don't take on much risk. It just doesn't work. Okay, inside all of our health plans, we have these different vendors, and you might not see them, right? They're not really visible inside of a traditional plan, but they're there. And actually, traditional carriers have bought up these vendors, right? They've monopolized the supply chain so that they can control things and make money off each of those pieces within your healthcare supply chain. So, again, the financial incentives of these vendors is going to dictate how well your plan runs. Okay, from a financial perspective, this is how all health plans operate. Essentially, you've got your fixed costs, which are things like administrative fees, stop loss premiums, and then you've got your variable costs, which are medical claims and prescription drug claims. Okay, so usually, mid-sized group, you've got about 30% fixed costs, 70% in actual claims. Okay, so again, the savings opportunity for the average company is $22,590 per employee per year. So let's say if your company operates on a 20% profit margin, and you save your 100 life group $259,000 a year by improving benefits for your employees, that's the same thing as selling over $1 million in product that year, which begs the question, how much top line revenue does your top salesperson at your company deliver each year? It's safe to say that, if you save your 100 life group $200,000, you're probably adding as much to your bottom line as your company's top salesperson, only without all the drama. Pretty cool. All right, so for the purpose of this strategy session, we're going to keep all of our plan designs exactly the same. And if there are any HR professionals who have been dragged onto this call today, I know that's going to seem like an unusual approach because for years, the only lever we've had is to tinker with copays and deductibles. Let's not do it. It's a waste of time. Okay, so here's the trajectory that lots of the mid-market groups, especially here in Central Florida, are on. And this is conservative. They're on an 8% trend or inflationary rate, right? But look what happens if we can slow down that inflationary rate. Let's say if we move it down to 6%, about 4. Look at the delta. How about 2? How about 1? And I'm sure you're asking, all right, well, how do we do that? How do we go from 8 to 1% without watering down coverage? Again, here's your strategy. If you're starting from a place of fully insured, here's your multi-year strategy. I think we have some more advanced people on the call here, so we're going to skip through this. Get yourself in a position where you can see price and quality. Now, since we probably have some mid-sized groups on the call, we need to talk about risk pools. If you're in a traditional risk pool with, if you have under 600 employees and you're in a traditional risk pool to help reduce volatility from year to year, that makes sense. Now, the problem with traditional risk pools, public risk pools, is that there's no lifeguard on duty, right? So, from what that means from a risk management perspective is that there's no one available to help your employees get the right care at the right time, at the right place, and for the right price. And this makes the entire risk pool sicker over time. Now, if you've moved into a medical captive, and there are tons of medical captives out there, they become very popular over the past, 5-7 years. You got to be really careful because it's all about how consistent the risk management strategies are within that medical captive. Lots of them are really poorly run. There really is no management over the whole thing. So you've got participants that are just not being helped, and that's going to drive up total spend. It's going to hurt everybody. It's the same thing as being in a public pool. So if you're going to be in a medical captive, really got to be sure you understand how the risk management strategies are being applied across the board, and that the vendors that people are using their financial incentives are more aligned with you, the client. And that's someone, hopefully the broker, is actively managing the plan so that when somebody needs, a total knee replacement, we can show them where to go and get the best results. Okay. Now that you're, further down the strategy here, and you can see price and quality, it's time to implement some pretty cool risk management strategies. So, the reality is right now, using a traditional ASO arrangement with a traditional carrier as your administrator, they're not going to let you bring in your own PBM. They're not going to let you bring in your own medical management company. They're not going to let you bring in a better network for your employees if you want to use a network. They're not going to let you do those things because that's not their business model. Unless you have 10,000, 20,000 employees, they're just not going to let you do those things. So the reality is that if you want to move the needle, you're eventually going to have to move to a independent third-party administrator. And here's the good news and bad news on this. There are tons of them out there. All right. So, benefits brokers should be spending a lot of their time vetting these companies to identify the good ones. So some of the low-hanging fruit, and I'm sure some people on the call have tried to address this already with varying degrees of success, but you want to attack your pharmacy spend right away, as soon as you can. This is the lowest hanging fruit that we see out there. I mean, there's really just no point in spending $75,000 a year on medications that you can source for $30,000 a year. There's just no point in doing that. So that's low-hanging fruit, pretty easy to do. And, if let's say it's the year 2026, 2027, maybe it's time to replace your traditional PPO network. A lot of executives don't realize this, but traditional networks here, especially here in Central Florida, pay about 300% of the Medicare reimbursement rate. What that means is that they're paying three times as much of what Medicare pays for the same exact services done at the same exact place by the same exact people. Okay, doesn't make any sense. So luckily here in Central Florida, there are actually some decent, robust networks that instead of working on a discount methodology, discounts off of infinity, which are the bill charges, they work on a Medicare Plus methodology. So you have upfront contracts that you can leverage that work on a Medicare Plus methodology. So lots of them here in Central Florida average about 125, 150% of Medicare reimbursement rates. And that's an upfront contract, no balance billing. So that's a pretty effective lever that you can pull to make your plan more equitable, generates interest-free working capital. And by the way, when you move to a Medicare Plus network, think about how the inflationary rate of Medicare, it's been pretty level over the past 10 years. In some cases, going down a little bit in some areas. So you no longer have this inflationary so-called trend. Pretty cool. All right, so let's talk about one of my favorite things, and that is rewarding value. So, here in Central Florida, we have one of the widest price variances in healthcare in the country. What does that mean? We have a price variance of about 1,100%. So that means that's the equivalent of your employees spending, $3 on a gallon of gas or $300 on a gallon of gas, right, for a business trip. So what we want to do is reward them for making a smarter decision. And a lot of what we buy in healthcare is just a commodity, right? MRIs are essentially a commodity. diagnostics, labs, these are commodities. So why not reward your employees for making a better financial decision when they go with the better option? And we, companies do this with travel and expense all the time. Just adopt the same methodology. So, when your employee goes and gets the $300 MRI at the freestanding facility down the street instead of the $3,000 MRI at the hospital, why not waive their copay or deductible? Just pay for it. It totally makes sense. Okay, let's look at some bigger opportunities. Let's say you've got an employee in North Florida. They need a total knee replacement, and just by happenstance, they end up at Capital Regional Hospital. Capital Regional, decent at some things, but as far as knee replacements go, they don't do very many of them. They only do about 90, 94 a year, and because of that, their quality metrics aren't that good. And even making matters worse, they charge $107,000 for each total knee replacement. So, when that prior authorization comes through, why not have your medical management company pick up the phone and say, hey, Bob, understand you're going through a hard time right now. We want to give you some options so that you can make the best choice possible for yourself. Did you know the Mayo Clinic, just an hour and a half away from here, they have much better quality scores for knee replacements. And if you go there, the plan is going to waive all of your out-of-pocket expenses. You're not going to pay a penny for your total knee replacement. So check this out. Mayo Clinic does over 500 of these a year. They only charge $37,000 for the same exact procedure. So you save the plan $70,000, and the employee has no out-of-pocket expenses and gets a better product. That's pretty cool. All right, moving on. So the benefits of rewarding employees for choosing high-quality providers it's a win for all stakeholders. Reduces your total spend, eliminates copays and deductibles, improves health outcomes, all things we need. Here's another interesting one. This is something you're going to want to do further down the road, but very important. And that's, partnering with physician groups. A lot of them, the independent practices, they're actively looking to partner with employers. So it's a pretty interesting and provocative opportunity. And I think, we need to take advantage of that because independent practices are hurting right now. They are looking for us to partner with them. And it's a win for everybody oftentimes when we do. Okay. What's going on there? Well, they want to spend more of their time practicing medicine, not insurance, right? Under the typical fee-for-service arrangement, especially after they've been bought by, primary care physicians have been bought by health systems, they spend about 40% of their day practicing insurance, just, doing coding. That's not what they want to do. So if you develop a direct relationship with primary care physicians, they can spend almost 100% of their time practicing medicine, taking care of your population. The cool thing about that is that when you actually partner with primary care physicians, now you can, and their financial incentives are aligned with yours. Now you can help control the rest of the healthcare supply chain, right? They no longer have any financial reason to order tests and procedures that your employees maybe don't need. They don't have any, they're not getting kickbacks for doing that. They're just getting paid to keep your population healthy. And so that's a huge opportunity because it helps avoid tertiary care that's oftentimes unnecessary and actually can be harmful to your population. So what does that look like in reality, partnering with a primary care physician? So here's an example of a 50-year-old man, went to the emergency room for chest pain. Look at how much the emergency room is going to cost under a traditional network arrangement. Whereas if they had gone to their direct primary care provider, look at the fees associated with that. The direct primary care provider saves them about $2,200 for that one incident. So that's a small example, but there's just a lot of these little things that add up and make a big difference. Okay, moving on. So here are just some of the companies here locally that have created more equitable health plans and generated interest-free working capital by optimizing their health plan. It's, we're not reinventing the wheel here. This has been happening for quite a while. We just need more companies to start adopting it. Okay, so again, if you optimize your health plan and implement this kind of a multi-year strategy, you're going to create about $1.9 million in interest-free working capital over the next 5 years per every 100 employees enrolled on your plan. And notice something, as your plan becomes more optimized, when you move further down this path, your employees' out-of-pocket expenses aren't going up. They're actually going down, okay? So that's a big deal, especially for those people that you have on your team that have chronic conditions. It's really going to help them manage their chronic conditions because they don't have to think about prices nearly as much. So, as executives, we have a choice here. We can continue down the path of higher premiums, deductibles, turnover, all of those things, or we can generate interest-free working capital by really maximizing and optimizing our health plans. So what can we do with the interest-free working capital? Well, I'm sure you have some ideas of your own by now. You can become more competitive in the market, as far as talent acquisition goes, raising wages. You can invest in R&D, develop new products. You can invest in growth initiatives, hire more salespeople, invest in marketing. Geez, there's so much noise out there. You can grow by acquisition, buy a competitor. You can hire more salespeople, and you can do all of these things by optimizing your health plan. Okay, so here's what we discussed. We talked about the challenges facing employers. We told the tale of 2 companies. We talked about how health insurance actually works. And we talked about a strategic methodology you can use to generate interest-free working capital. And let's see. Okay, email me at donovan@healthcompassconsulting.com. I will send you 2 white papers. The first one is how to turn OPEX into EBITDA by optimizing corporate health plans. Second one is on 4 ways employers are fixing healthcare right now. Hope that was helpful for everyone. And with that, let's open it up for questions.